Okay, Dr. Katie Passaretti, please spell your name for us and what is your title?
Sure, Passaretti, P-A-S-S-A-R-E-T-T-I. I'm the Medical Director for Infection Prevention for Atrium Health.
All right, Dr. Passaretti, what's this about a cluster in one of Atrium Health's hospitals?
As we are all experiencing right now, there has been a very, very significant increase in the number of COVID cases that we are seeing in our communities, in our clinics, in our hospital setting. This is due to the spread of the Delta variant, which we are seeing play out is much more easily spread from individuals than prior versions of COVID. With that, whether you're at home, at work, at the hospital, there is potential for people to get infected. And it's so important for us as a community, us in healthcare, to do everything we can to help prevent that spread. That means getting vaccinated, encouraging your friends to get vaccinated, and ensuring that we're wearing masks when we're with individuals outside of our household, inside.
So the people that work for you can get sick just like anybody else. When that happens, what do you do?
Yeah, so, our teammates certainly can get sick like anyone else. We put a number of measures in place to make sure that that is detected quickly, that we screen our teammates for any symptoms and make sure that as soon as possible, as soon as they notify us, that they are kept out of work and away from patient care areas. When there is concern about spread in an area, we do contact tracing, so reach out to individuals who may be impacted to make sure that they are offered testing. That's true for teammates. That's also true for patients. In this case, we sent community paramedicine, so medical professionals, out to the house of the individuals impacted if they were willing to get them tested and do a medical assessment to make sure that everyone is as safe as possible. And of course, continuing to make sure that whether in our hospitals or in our community, that everyone is following the right standards to make sure that we're preventing spread of COVID right now.
So among the teammates in this group, some of them were vaccinated, some were not. How does that happen? I mean, isn't the vaccine supposed to protect you from getting this?
Yeah, so no vaccine is 100% perfect, and I want to restate that because it is so important to hear right now with the increased cases in the community and with this Delta variant that spreads more easily between individuals. We are going to continue to see vaccinated individuals with mild cases of COVID. That does not mean the vaccine doesn't work. The vaccine still, one, protects individuals. You're less likely to get a mild infection if you've been vaccinated. And what it continues to be exquisitely good at is preventing COVID-related hospitalization and death. Place after place, time after time, we know that over 95% of our hospitalizations and COVID deaths continue to be in unvaccinated individuals. The best way we can protect ourselves from being in this situation moving forward is getting everyone vaccinated to prevent the development of even scarier variants in the future.
So with this Delta variant spreading, it's widespread in the community now. If someone needs to go to the hospital, should they be worried?
So you absolutely should get medical care if you need it, regardless of the setting. If you're having chest pain, if you're having, if there is a reason that you need to go get medical care, absolutely do. But please use those resources wisely. Right now, hospitals are very full with COVID patients and non-COVID patients. So, it's not the place to go to get testing if you're doing relatively well. So absolutely seek medical care if you truly need it, but use those resources wisely so we can continue to care for everyone that comes in our doors.
So if I'm a member of the community, I don't have COVID, I don't have a shot, what should I do to protect myself?
Best thing you can do is get vaccinated today if possible. The protection kicks in fully 2 weeks after you finish the series, but you get some protection earlier than that. So get vaccinated, get vaccinated, get vaccinated. And with the level of spread in the community for right now, I would really encourage people to start wearing masks, especially when they're indoors, in indoor settings, with people outside of your household. We need to do both right now. That is the point we are at, to continue to make sure we're caring for everyone.
Dr. Passarelli, thank you for your time this morning.
Thank you so much.